Hello.
Hello. Also, my voice not see the attendance. That year when there was COVID.
Good evening, everyone, and welcome to the Medical World First Aid course. My name is Anthony, and I'll be taking you guys through the session for tonight. I want to thank you all for joining us for today. I know you had a busy schedule all day before you decided to join us on this. I had to mute everyone so that we don't get those cross discussions along the line. So it's basically a straightforward course. We'll do this for a little while, maybe an hour plus, then we'll take a little break of 15 minutes just to stretch around and make sure that we're able to let the blood flow around our body. And if you have any questions, please remember to put it up in the chat box and I'll take the questions when I see them. Don't worry about it. I'll still take everything as it goes on. So if there's any part that you don't understand, please do well to ask the questions. Remember that today we'll be having just first aid, and tomorrow we'll be taking the CPR part of the course. So once again, thank you everyone for joining, and let's kick off. So we're starting with the introduction to the EMS system. And the EMS, for those who don't know, is the Emergency Medical Services. Now, an injury or illness can actually occur at any time in an environment, and as a first aider, which you plan to be, or an emergency responder, you actually become part of the system to help those who are sick or who are injured. And it's expected that you provide care for the ill and injured persons until the more advanced group of persons arrive. As we say this, we have to note that over 25 million, there's over 25 million workplace illnesses and injuries per year or annually. Now, another thing you have to note is as a first aider, you will provide care for the ill and injured, like I said. Remember that the early recognition of medical emergencies, which is combined with prompt delivery of first aid, can actually make a difference between life or the death of the victim, the recovery time, and the temporary or the permanent disability of that victim. So the faster care is given to a victim, the faster the person gets to survive per se, or is able to have all parts of the body working well or be disabled for life. Now, the EMS system actually includes sophisticated communications systems, ambulances, helicopters in advanced countries, fire and police resources, and a variety of skilled individuals who can make the system function. It's expected that the EMS is to respond to, care for, and especially transport victims. Now, when we talk about the EMS, we're actually talking about you have to begin with recognizing that an emergency exists and being able to provide that life-supporting care and first aid until more advanced people arrive. When we talk about more advanced people arriving, we mean maybe the ambulance crew, the nurses that are part of the ambulance crew, or emergency services. When they arrive, they are able to take over from first aiders, those who are providing the first point of care before they arrived. So as a first aider, you have to be able to provide that initial medical care for the victim with the limited resources you have at hand. So it's not like there's nothing available to help this patient, so we can't do anything. Sometimes you actually need, or most times you actually need to improvise to actually make sure that you can save someone's life. So you have be able to deliver initial care with, like I said, limited equipment, primary assessment, perform life-saving interventions. The EMS system actually begins with those who recognize that there's actually an emergency and try to provide life-supporting care and first aid until the emergency crew arrives. Now, you also assess a victim and provide these interventions, irrespective of what it may be. It can be there's an accident scene and you just arrived. You have to be able to know, okay, what do I do? How do I do it? Is this safe? Is this unsafe for me? Is this unsafe for the patient? If I try to help this person, would it help the person per se, or would it make the person's situation way worse than it was before I arrived? So you have to know all this and know these correct steps to help or not to help. Because there are some scenarios where people rush in to help and they tend to make that situation way worse. They're helping per se, but it's actually not so much. Now, as a first aider, first thing you have to note is that you actually are a safety advocate. You need to step out of your normal work duties to actually provide emergency medical care. It's a fact that when there's an emergency in Nigeria or any country you find yourself in, once people see that some other persons need help, everyone always rushes in to help. So first of all, you have to know that you need to be a safety advocate. You have to ensure the safety of the public, customers, if you have a business, your colleagues, and your employees or any other person in your workplace. You need to be able to advocate for the ill and injured, help promote injury and illness prevention in your facility. You need to ensure that the safety of all persons in the scene is secured, but you also need to know that you're going to end up being a lifelong learner, because it's not that you learned, you don't want to be in a situation where you say, I learned first aid 20 years ago and I don't think I need to relearn again. Every 2 years, there is something we call renewal courses, where you need to know, because there are changes that are made every 2 years. You need to know, okay, maybe you need to walk to the person before you start helping. In 2 years' time, they might decide that, okay, instead of walking, you need to run to the person. It might be you need to run from the left is better than running from the right. So all these little tweaks, they are very important ones, but there are also some little tweaks that they make to the courses that you need to note. So having learned first aid in 1967 is not the same first aid that you're going to learn in 2024. The skeleton is still there, but there are also some few changes. You need to also remember that people rely on you to consider what is best for them under the circumstances and to make appropriate decisions regarding the care that they actually need. So if you tell somebody, hello, sir, Oga, relax, I want to help you, automatically to that person, the person assumes that you know what you are doing. You know how to help him or her. So they would actually relax and lay their lives in your hands. So you actually need to know what to do and how to do it. Finally, you also need to note that when you're administering first aid, you should never delay actions. Once you come in, the next step is, what am I doing next? How am I helping this person? Do I need to do this? Do I need to do that? It's something that you have to take step by step immediately, and don't wait for anyone to come and tell you, stop what you're doing. This is not what you're doing. Also, when we are saying you need to activate emergency medical services or wait for the ambulance, there are some scenarios where it might not be necessary to activate emergency responses, but it's always best to do so just to be on the safe side. Then some people ask, what about ethics? How safe am I? What is the legal implications of trying to help someone? We all know that there are some times when you try to help someone and unfortunately the person might not survive. Some persons will hold you accountable. This is where ethics and legal principles actually come in. Now, for those of us who might not have forgotten, ethics is actually the study of principles that define behaviors as either right, good, or proper. Now, in assisting others as an emergency responder or a first aider, you are committed to assisting an injured or ill person who is in need. You are accepting to the roles and responsibilities, which means you must apply the care knowledge you have and the skills you have to the best of your ability. You must, again, it's kind of emphasized, you must be committed to assisting others. You also must be committed to continue training, where you remain committed to keep your knowledge and skills fresh and ready when exactly you need them, like I mentioned a few minutes ago. Confidentiality. When there's an emergency, you tend to see people at their worst or vulnerable situations. This happens both physically and emotionally. As a result, you actually have an ethical obligation to respect their privacy and maintain a high degree of confidentiality. If in your place of work you have an emergency and something happens to someone, it's not expected that after helping the person as a first aider per se, you go to your colleagues and start telling them the story of what happened, how the person was crying, or what the person told you in confidence. That's actually wrong. Keep private things private. Your job is to help the person, make sure that the person is comfortable, make sure that the person survives, and hand the person over to the emergency services. That's it. You don't need to go discuss what happened in that scenario. You have to know that you only are allowed to share information about the event or the person's condition with those who are involved directly in their care. You cannot disclose the person's information to any other person. And the persons who are directly in their care are the healthcare providers, which is the nurses and the doctors, the emergency medical services personnel, which might be the ambulance services, the hospital personnel, and any other person, which might sometimes include the person's family if they have the approval to do so. Now, I'd like to open up the chat box comment section. So I'd like to ask you to give me an example of a situation where you think it would be appropriate to share personal information about the patient with anyone else. So you can unmute yourself, then if you have an answer, I'd like to hear it. Okay, let's start with Rafiat. Tim Musa, could you hold on, please? Rafiat, you could go ahead. Okay, Rafiat is off. Ifena. Anyone? Okay, let's see the chat. Let's see the chat box. Okay, we have when it's a case of child abuse. fire outbreak, a patient with an established high blood pressure, okay? Contagious diseases. So we have 3 persons who just answered that. Fire outbreak, contagious diseases, case of child abuse, patient with high blood pressure, yes, nice. When an individual is between life and death, sexually transmitted diseases. Sexually transmitted diseases, unless the person has that approval, sometimes you need to have verbal approval before you do that. Salim, you can unmute yourself. I think you raised your hand. Salim Nura Yusuf, you raised your hand. I've asked you to unmute, but... Okay, so these are actually scenarios where you can find yourself. Ifena, okay, I'm not sure what you're pointing at. I'm not sure what you're pointing at, Ifena, so I can't actually tell. Patient with diabetes. Okay, so that's actually nice. You guys actually showed different scenarios where you can share personal information, but you have to know some persons might not want you to share the information, so you have to be sure about it before you do share, because sometimes you can find yourself in a scenario where you think you're trying to help the person and you share an information, and in the end, when the person wakes up, the person will tell you, I never...
Gender-based violence.
Gender-based violence, yes. But when we are talking about gender-based violence, yes, I can accept that. Fire outbreak, yes. When somebody stops, yes. Sorry, I need to mute everyone again, because this is not sure who muted themselves. Okay, when there's an overwhelming need for external help, yes, suicidal attempt. Well done. Thanks for actually sending this in. That's actually nice. You know that at least we're interacting in this. So looking at the next parts, person with mental health, person with RVD, suicidal attempts. Yeah. We all know the story of most of us know the story of the Samaritan, the Good Samaritan. There's actually a law called the Good Samaritan Law. The Good Samaritan Law is designed to actually encourage anyone to stop and render care to an ill or injured person by limiting the exposure to civil liabilities, which means that if you try to help and the person gets worse or the person passes away, you are not supposed to be held liable. But what we should note is that in most cases, the Good Samaritan laws only protect people who are rendering care without expecting any payment in regards to that. This actually does not apply to those who are working as a healthcare provider, EMT or paramedics, unless the responders act recklessly or with gross negligence. It is very unlikely that any legal actions will be taken against someone who's trying to help a patient or provide first aid. Wherever you find yourself working, if it's a facility, company, you should speak with your employer if you are concerned about any liability when you're asked to respond to an emergency. You can be working in a facility right now as a first aider, and there's an emergency, and they say, Mike, you are the first aider, go and help. You are not sure what will happen. Maybe you go to the emergency and you find out that it's something that is way past your experience or your know-how. If you're not sure, it's best to always, before an emergency ever occurs, to ask your employer, what happens if I try to help and this doesn't go the way we plan it to go, or this goes worse than this? What happens? Am I going to be held liable or not? Let your employer tell you point blank, yes, you'll be held liable, or no, you will not be held liable, and you take it from there. Like someone mentioned, child abuse it covers this. This is what we call duty of care. This is a requirement that the person acts towards others and the public with watchfulness, attention, caution, and prudence that of a reasonable person in a similar circumstances would use. Duty of care is very important. You need to know that if you see something wrong, you have to inform the necessary persons in charge. You see a child being abused, duty of care, child safety, you inform the necessary bodies that are in charge of that. They'll have something to do about it. Most times, it's not advised to try to do something yourself. Always note that you need to inform whatever services or organizations are in charge of that so that they can do the necessary actions to take care of that. You also have something we call breach of duty. If you have a legal duty to render care and you fail to do so or do so in a negligent manner, that's considered a breach of duty. An example could be failing to provide appropriate care to someone in need. We've all had the story of and seen videos of what happened last month or last year, where some healthcare care workers were actually filmed maltreating a patient who's in their care home. Now, that's a severe breach of duty. And as we all know, I think they are currently in prison at the moment. So you don't want to do anything that is wrong or reckless and grossly negligent. You actually want to do your job and do it well at the same time. We also have something we call abandonment. This is a situation where you find out as you're a first aider in your office or in your company, and you have somebody who is ill and injured. You approach the person, you give help, then before the emergency services arrive, you leave the person to go do something else. That's called abandonment. It meant that you try to help the person and you abandon the victim to go somewhere else. And what happens if the emergency services people come to the patient and find out that the person that you said was alive and in good health was actually dead when they arrived? So it meant you did nothing. You abandoned the patient you abandoned the victim who needed your help. So when you're in a situation that you find yourself in, if you're trying to give help, please stay on site till more advanced persons arrive, because they need the necessary information that only you might be able to give them. This person has been coughing, he has not been swallowing well, he has been complaining of chest pain. Those are little informations that you can give them before they arrive, when they arrive, not when they come, they now start trying to start all over again to find all this information, and the person might not be able to talk when they come in. So that's a problem. Another thing you need to note is you need to obtain consent before you try to help anyone. Yes, the person needs help immediately. We all know that there are some situations that you find yourself in that you tell someone, "Can I help you?" The person says, "No, I don't want your help. I don't need you touching me." Even if the person is coughing and coughing hard, and you ask the person, "Excuse me, sir, can I help you?" The person says, "No, I'm okay. Don't help me." Again, you are not expected to leave the person. This man said he doesn't want my help, so what am I doing here? Let me go. Once you leave, we go back to what we call abandonment. You've abandoned your victim or your patient. So the person tells you, "Okay, I don't want your help. Don't touch me. Please stay there and monitor the person." Because once the person says, "I don't want your help," and they collapse, or if they collapse, once the person is unresponsive, it automatically means that that person needs help and there's implied consent. Then you can help. If you try to help the person, "Hello, sir, can I help you?" and the person says, "Yes, go ahead," then you can go ahead. And remember, when you're asking someone, "Can I help you?" the person has to actually be conscious in the first place. So there are different forms of consent. We have expressed consent, when the person is still conscious and you ask the person for permission and the person agrees. It can either be verbal, non-verbal, or written. Hello, sir, can I help you? The person nods their head. That's yes. Because the person might not be able to speak. So nodding head means yes. You ask the person, can I help you? And the person shakes their head. Shaking their head means no. So you go with that. You have express consent, implied consent. Implied consent means adults who are unconscious are in need of care. You've already arrived, you find out that the person is unconscious. You can't ask an unconscious person, can I help you? No. Implied consent is given. You immediately start helping the person. If it's for minors, it's implied consent because their guardians or parents are around them. So you have to ask their parents and guardians, can I help your child? If they say yes, you help. If the guardians or parents say, no, we don't want your help, again, hands off and monitor. One other thing you need to note is mental competency. A person must actually be mentally competent to legally grant consent. It's important to understand that people who are under the influence of alcohol and drugs or are badly injured, sometimes they do not fully understand their condition and may not be competent to refuse care. But you have to note that when in doubt, begin care and always activate your emergency action plan. Emergency medical services, when they come in, they'll take over and you're off the loop. So remember, you don't want to overstep your boundaries. Once emergency medical services come in, your job is done, hand over to them. Again, like we previously mentioned, we have negligence. You need to provide reasonable and prudent care at all times, but within the limits of your training. Like I just mentioned a few minutes ago, you don't want to overstep your boundaries. Your job as a first aider is first aid basics. You're not expected to go and enter into the hospital and start dragging the position of the nurses or the doctors that you know what's best. No, just stick to what you know and don't go across your line. You need to also notice that using good common sense and keeping the best interests of the ill or injured person in mind at all times will actually go a long way in preventing claims of negligence. This is very important for you if you're planning on being a first aider in whichever scenario you find yourself in. Because if you fail to take action, then there's a reasonable aspect of negligence because they'll accuse you, you were supposed to do this, you did not do this, you neglected your victim or you neglected your patients. Refusal of care is actually a very mild part, almost the same thing with abandonment. Not all, like I said, not all ill or injured persons want someone to take care of them. It might be religious belief, it might be they are afraid, they have a terminal illness, they are afraid of receiving their bills or fear of pain. You should attempt to always reassure and calm these individuals, whether ill or injured. Once they refuse care, just try to calm them down, but don't enforce care on them if they don't want it. You have to also not dismiss them or leave them alone when they say they don't want that care. Battery is, like I mentioned a few minutes ago, we saw, for those of us who haven't watched the video, that video of the care workers battering the old lady, you are legally, is implied there, you are not legally permitted to force care on anyone. If you attempt to restrain or force care on anyone, it will be considered battery. And that's why those four individuals, those four Nigerians are actually hearing the music, right? Listening to the music right now, because that's called battery. They forced the old lady's legs and arms left and right, forced care on her and you could actually hear the lady actually saying, no, I don't want this, no, but they actually forced the care on her. It doesn't matter if she needed a change, or if she needed a new clothes, or if she needed a new pair of Pampers or anything, adult Pampers. They actually forced care on her, and that is battery. So for this part, the last part is minors. A minor can actually cannot actually legally refuse care. But if the minor is actually refusing care, then you must take it up to the next step, which is to inform the EMS or your facility wherever you find yourself, and inform the healthcare providers. They are well equipped to take care of this situation if it happens. They can inform the parents, they can inform the guardians, and those might actually give implied consent. Maybe the minor was afraid of the first aider that is coming to care for them, or afraid of the next step to take, and they say, no, I don't want anyone touching me. Again, do not force care on them. If they say they don't want the help, inform the necessary individuals. You could get implied consent from parents or guardians, and you could go ahead with your next step. Okay, so we've gone 33 minutes. Now, for this, you have suspicion of abuse or neglect. We actually need to cover legal aspects so that you know that when you say you're a first aider, it's not just you want to be a first aider, you run in and you run out. There's actually legal aspects that are attached to the first aid job that you want to do. You need to know what is safe for you and what is unsafe, what is correct, what you're rightfully allowed to do, and what you're not allowed to do. Now, a mandated reporter is actually someone who is legally, again, the word legally, obligated to report any suspicion of abuse or neglect. They are legally obligated to report any suspicion of abuse or neglect. You might be working with people in your office and they see someone, anytime you're on duty, someone is always having a bruise, or someone has fallen down, or someone they're always complaining on pain on the leg when you are always available to work. That's suspicious. So they are legally obligated to actually tell the management that, yeah, anytime Mike is on duty, the care home persons, they're always complaining of either back pain, hand pain, neck pain. I think something might be happening. And they can take it up from there. So the laws are actually very clear and state that a mandated reporter must immediately report any case of suspected abuse or neglect to either law enforcement or child protective services. Now, if you're in the UK, this is a very, very important part. The UK law enforcement, they do not joke with child protective services and law enforcement or anything concerning neglect, abuse, or battery. Once there's any inkling of this, they take it up and they take it very seriously. So you don't want to actually do something wrong. There's no had I known. So legal, like I kept on harping on, there are legal documents or advanced directives, which helps to outline a person's wishes regarding his or her own health care. This is becoming more common with a lot of persons. We might have heard of if we watch a lot of movies or series, we might have heard of this, DNR. And DNR is do not resuscitate. DNR is actually do not resuscitate. This is the most common one that we all know about. It's usually initiated when a person has a terminal illness, but you have to know that all DNRs are not the same. It actually reflects the specific wishes of the person and their family members. You have to know that DNR means even if you love this person from heaven to hell to wherever, and the person is about dying, it means you're not allowed to give CPR to resuscitate the person. You're not allowed to do anything medical to try to get the person back to breathing and their heart beating. Once the person says, if I'm at home and I collapse and I'm dying, once I have a DNR, don't bring me back. Allow me to go peacefully. I want to sleep and go wherever I need to go to. Even if the person is in the hospital and the person was receiving care and the person goes into cardiac arrest in the hospital, it's expected that when somebody is in the hospital and the person is dying, the nurses and the doctors will try to resuscitate the person or to make sure the person stays alive. But for someone who has a DNR, once the person is in cardiac arrest or has a medical emergency, you don't do anything to try to resuscitate the person. You actually allow the person to go and go peacefully. Now, this is another important part. You have to be aware of hazards. Now, emergency scenes can present a wide variety of hazards such as sharp metals, broken glass, spilled fuel, unstable vehicles, fire, explosions, or hazardous chemicals. In some way, a passing traffic can actually also pose a serious risk. One thing you need to note is you need to avoid the urge to rush in. We actually need to avoid the urge to rush in. There was a fire outbreak in Nembe in Port Harcourt, I guess, where boats were burning. If you're not trained to fight a fire, or if you're not trained to save victims from inside a fire, it's always advisable you do not rush in. Safety must always be your first priority. Before you rush into any scene, you have to be sure that that scene is safe for you. And you have to do this by observing the entire scene to identify any immediate or potential hazard that might be or that might affect you. So to cap it again, your safety is top priority. There's no two ways about that. You have no obligation to help an ill or injured person if it puts you at risk of harm. You actually have an obligation to do your best to mitigate obvious hazards before entering a scene, as long as you can do that safely. Now, you have a mnemonic that we can use to do this to be sure that you're safe. If you have a pen and paper, this will be a right time for you to write this. And it's called setup. S-E-T-U-P, setup. So break it down. S means stop. You need to stand still and observe the scene for any potential hazards. Stop, stand still, observe the scene for any potential hazards. E, environments. Observe the surroundings and look for any environmental hazards. T, traffic. Look for any oncoming traffic and take steps to alert drivers that a hazard exists. We also see this when there's a head-on collision between two buses when we are traveling on the express. You see people carrying green leaves on branches and waving traffic down to tell them that, yes, there's an accident in front, please slow down. You're alerting drivers that a hazard exists in front. Next, we're looking at is unknown hazards. You actually need to keep an eye for any potential hazards or ones that are not immediately obvious. An example of this could be, we could say a bomb blast. We know that sometimes when there's a terrorist attack, the usual MO is there's a first explosion, which kills and maims a few persons. Then when healthcare providers sometimes rush in, there's a second explosion, which kills a lot more persons. So when you see an explosion, even if people are shouting, help, help, I'm dying, you actually need to look around. So far, the person is still conscious to shout and cry for help. You have a few minutes to make sure that it's safe for you to approach that person to help the person. So you first need to, and that's where P comes in, you need to protect yourself and then protect the ill and injured person. Now, when you get to the person, you actually need to also use appropriate barrier methods to protect yourself from exposure to blood or other bodily fluids. And this also helps you to protect the person you're caring for. Before you help somebody who is bleeding profusely, you don't know the person from Adam, you don't know the lady from Eve. So you actually need to wear your gloves to protect your body from coming in contact with the person's blood. Let me see if someone has a question. Okay, you're just copying, yeah. Oh, sorry. DNR is do not resuscitate. Thank you to Tega, you actually answered that. Do not resuscitate, thanks. So you also need to be aware of pathogens. These are actually germs that cause diseases and can be spread from person to person, and some of the most dangerous pathogens are actually carried in the blood. HIV is an example. You're looking at exposure. This is a condition of being subjected to a fluid or substance capable of transmitting an infectious agent in a manner that may prove harmful. There are various routes of exposure. It can be either through ingestion, inhalation, absorption, or injection. Ingestion is when you eat or swallow something that is contaminated with those pathogens. Inhalation, when you breathe in airborne pathogens, particles that contain disease-causing pathogens. We all saw this when COVID-19 was a thing in the world in 2019, 2020, 2021. Absorption, this occurs when pathogens are allowed to be absorbed through contact with the skin. We saw this with Ebola, right? When Ebola was actually going around the world, where everyone was avoiding shaking hands or hugging their friends and colleagues. Everybody was scared of that. So sorry, if I could just answer this. In what cases do we use DNR apart from the patient's wish? You don't use DNR. It's the patient's wish for you not to resuscitate them. You don't just decide on yourself, okay, let me not resuscitate the person. But you have 47 minutes or more. Remember, when you are doing CPR, you don't want to continue doing CPR for an hour, 2 hours, 3 hours. You have some few moments to do this and not do that. So I'll allow Mr. Joe to take that. Injection, this can occur when someone is poked or struck with contaminated needles or a sharp object. This actually, the injection part is actually a scene where healthcare providers are trying to cap the needles. There are newer models of syringes and needles where it's a bit safer for them, but previously, when most persons are trying to cap the needles, they tend to prick themselves, and the case actually goes way worse than that. You need to also minimize exposure. It's actually impossible to completely protect yourself from exposure, but you must take steps to minimize exposure to these pathogens. And the first step is realizing that any body fluids may or can contain these pathogens. In your place of work, you have standard precautions. Every company has this. If you haven't seen it, I advise you check with your office and ask them what their standard precautions are. These are a set of infection prevention practices healthcare personnel use when caring for people. Even first aiders, you should have it in your place of work. You need to know what are your standard precautions, what have they written about it. If they don't have one, then I definitely I'll definitely advise you get your company to write one out. The philosophy is that all people should be considered potentially infectious, and that you should take the necessary precautions to protect yourself. So if you're in the office right now, you're the designated first aider, and they call you, sorry, I'm using Mark. I hope no one, I think someone's name here is Mark. Mark, there's an injury somewhere in office this and office that, building that. Please, you need to go and take care of the person. You rush to the person. Assume everyone is infectious, and first thing first, put on your gloves. Once it concerns bodily fluids, put on your gloves. You need to protect yourself. And this is where we enter into taking precautions. So in 10 minutes, 12 minutes time, we'll take our first break just to stretch around. And if you have any questions, you can ask them. We'll take it off from there. And that will be 19, 20, 30. That's 8:30. We'll take a little break. After 15 minutes, we'll come back. 8:45, we'll continue and finish up. So BSI, or body substance isolation precautions. Our skin actually does an excellent job of keeping harmful pathogens away. However, it can be damaged. So BSI, or body substance isolation precautions, this is what you must do to minimize exposure. We all did this during COVID-19. PPE, wearing your mask, wearing your face shield. Yeah, they are very important. They are uncomfortable, but they are actually needed. These PPE might include protective gloves. This might be latex or non-latex and should be worn at all times when caring for an ill or injured person. Eye protection might be safety glasses or goggles and a face shield. Their function is to prevent or protect the eyes from being splashed with liquids. Finally, masks. They cover the nose and the mouth and protect also from splash liquids or fluids, as well as inhaled pathogens. But you have to note that even the best protective measures sometimes fail. If you're exposed or if you suffer a direct exposure to blood or person's bodily fluid, you should immediately wash the area with soap and warm water. Your employer has to inform or tell everyone if there's an employee with a possible risk of exposure, so that there's an assessment of this risk, and they must develop a written exposure control plan intended to minimize said risk. You as a first aider, you must become familiar with your employer's written exposure control plan, as it will help you through the steps following an exposure. You don't want a situation where you get exposed and you're not asking, what should we do? What should we do? Your company HR person or person in charge is telling you, I don't know. I think we should do this. I think we should do that. There has to be a set of control measures so that when this happens, they know that, okay, this has happened. This is the next step to take. We're doing this, we're doing this, we're doing that. And that's how it works out in a competent place. These are examples of protective equipments. You can see the goggles, the masks, the gloves. These are all needed, sometimes uncomfortable, but you actually need to know that these are available and you need to know how to use them. So the first practice we're going to do before we take our break is taking off our gloves. So for those of us who have our gloves, we're going to have to use this. I'm not sure I'll be able to see the screen. Let's see. Okay, my video is on. Can you see me? So if you can, the first thing you need to do is, I'm going to mute you. For anyone who wants to mute yourself, first thing you need to do is you need to have your pair of gloves, right? Ready? So now, if you can see this, you note where, okay, I need to mute this again. Sorry about that. If you note this, you can see where it's being pinched. Using the thumb and the forefingers, you're not pinching the edge of the glove. You're pinching the top on your palm. Pinch up, out, pull out. Once you do that, you now fold the pulled out glove into your right or your left hand, depending on the one that you use. You fold it in, and once you've done that, you now use the ungloved hand to go under the glove, pull out, and take it out of your hands. That's the way to remove your glove. This is the actual way to safely remove your glove. I'm going to do this for you so that you see it yourselves and know how to practice amongst yourselves. Okay, 1 minute while I just put this on. Okay, let's start the video. Okay, so I hope you can all see me again. One thing you have to notice, you can see what's happening here. Now, if I was working with someone who was bleeding profusely, this is actually very risky. And what I mean by that is my top actually coming in contact with the gloves. This is actually very important, very risky. It's always advised that when you're working with anything concerning bodily fluids, please, either you're wearing short sleeves or if you know they're wearing long sleeves, try to take it away from your gloves because you don't want the tips of your, sorry, you can't see anything or you can't hear my voice. Is every other person having that problem? Yeah, okay, we can hear you. Okay. Okay, so you want your dresses away from your gloves. Another thing, please, you also need to watch your fingernails. You're expected, if you're a first aider, healthcare provider, you're expected not to keep long nails because your long nails could actually puncture your gloves. Also, remove your rings. You actually need to remove your rings. If you're wearing rings, please remove them before you wear your gloves. If you're wearing bangles, if you're wearing wristwatches, please also take them out. Sometimes it's not so safe. So first things first, like I said, some persons, when they want to remove their gloves after helping the victim, this is what they do. You can see my thumb now. My thumb is already just touching my hand, sorry. So if I do this, this is wrong. So the best thing you expected to do is pinch using your thumb and your forefinger. Pinch, pull up, out, fold the pulled out glove into your palm. Again, my hand is free. I'm not touching anything. Put your fingers in, up, and out. And this is how to safely close your, remove your gloves. Okay. So that's it for taking off your gloves. Again, remember, you need to safely do this to be able to go ahead there. Okay, so the next part is principles of lifting, moving, and positioning ill and injured persons. You need to move a patient safely, but sometimes it's best to leave an ill or injured person in the position they are actually found. You have to make that decision. Is it safe to move the patient or is it better to leave the person where they are? You need to think about the person's comfort. In most cases, some persons are actually more comfortable in the area you find them compared to when you try to move them. It's not that they are not in pain. It's simply that that position they currently are in is where they don't feel the most pain. So they are comfortable there. They feel that if you move them, the pain will come back way worse. Don't be in a hurry to move someone that is ill or injured. You need to take time to evaluate the situation and their condition before you decide to move the patients. You have an emergent move or emergent versus non-emergent move. These are situations where it is necessary to move an ill or injured person and to move him quickly. That's an emergent move. You can actually use this type of move if there's some sort of external threat, but you always need to keep in mind that the scene must be safe for you and others to approach before you decide to try to move the person. There are a few problems that you can see before you decide to use the emergent move. And this is when the person is having problems with their airway, breathing, circulation, or having severe bleeding. So it is necessary to move them away from where the emergency happened, because these problems can actually be life-threatening, and you need to get these people care immediately. So you actually need to move them out of that scenario. Now, apart from these problems that I mentioned, does anyone have an idea of what type of emergency can determine or that can actually emphasize the need to move someone? If you can put it in the chat box, I'll appreciate that, please. Any scenario where you find yourself that you actually need to move the patient. Yeah, burns from what? Jennifer, you actually mentioned burns. What do you mean burns from what? Was it from a frying pan when the person was frying plantain? Road traffic accident, fire accident? Yep. Yes. So you can see you just said burns. It can be plantain, it can be dodo. So you have to actually know which one is there. Smoke carbon monoxide inhalation. I'm sorry, for smoke carbon monoxide inhalation, do you have an oxygen on your back that will protect you? Again, remember, you don't want to overstep your boundary. For someone who says drowning, do you know how to swim? Can you safely, have you been trained to save a drowning victim? There was a story a few years ago about someone who saved 18 persons from a capsized boat. And when he went back to save the 19th person, he actually drowned in the process of saving the person. So you can see, if he had been trained, he would know that, yes, when you are getting tired or when you're getting worn out, you actually don't want to continue risking yourself. He actually saved the most that he could save, but he wanted to save some more, and that's where he lost his life. He wasn't trained to save drowning victims, but he just went there. Fire outbreak, yes, fire outbreak, but again, are you a firefighter? You might hear your family member or someone inside a burning building, and the person is shouting, "Daddy, daddy, help, help, mommy, help." And you say, okay, I want to run inside to go and save the person. What happens if you run into the burning building and where the victim is, the wall collapses and opens up, and the person runs out of the building, and the building now collapses, blocking that area. You that went in to help the person, fire now blocks your back and blocks your front. You're gone. So electrocution, yes, but remember, what do you do when you have electrocution? You first of all have to switch off the mains. You have to switch off the main power before you try to move the person. Or like they say, some people will say, use wood to hit the person away from the electric cable. You must be sure that you can see the wire before you try to help the person. Well done, everyone. Natural disasters, earthquake. Yeah. Again, you must be suitably trained to do most of this. But thank you for actually sending this in. They actually appreciate it. One other thing you need to note is proper body mechanics. Lifting is very important. There are some of us here who might be having waist pain, or you might have tried to lift something and you just had bam in your waist. That is it. There is actually what we call musculoskeletal disorders. You've actually sprained your waist, or sprained the bone, or sprained the nerve there, which is now being compressed. So you actually need to know how to lift. If you are working with stretchers, you need to know how to position yourself to lift the stretcher up safely and competently. In order to reduce injury, you must understand this. So good body mechanics involves using the proper use of your body to facilitate moving and lifting with the goal of maximizing effectiveness and minimizing injuries. It can, if you don't do this well, it can result from maybe a simple pulled muscle to a severe back injuries, or injuries to your shoulders, or many more. Now, what you should understand is that 30% of all occupational injuries are caused by improper use of proper body mechanics. When people don't lift or move well, injuries can occur. So what you need to note is you need to position your feet properly. Now you can look at this, you can see this picture. It looks like she's squatting, right? But she's not fully squatting. You can see her feet are spread evenly. So you need to position your feet properly on a firm level surface, comfortably apart before you try to lift. Then the next thing is you need to lift with your legs. Bend your back, keep your back straight, keep your back as straight as possible and bend at the knees. You know, when you see a box on the ground, some persons always try to bend from the waist down to pick up the object. That's unsafe. The best way to lift any object from the ground, you can use an infant or a child to learn this. Children, when they want to lift something from the ground, they don't bend from their waist to pick it up. They always squat down, hold the object, and stand up. That's the best body mechanics for picking up a heavy object. You need to avoid leaning to either side when lifting with either one hand or two hands. You actually need to, again, bend your knees to grasp the object while keeping your back straight and moving upwards. Also try to minimize twisting or turning while lifting. You don't want to cause any twist in your spinal column that might cause more problems. And keep the weight as close to your body as you can before you lift. You can see how close the stretcher bed is to her. She's not widths apart from the stretcher bed. She actually came as close as she could, bent the knee, kept her back straight, and she's lifting with her muscles to go upwards. Before you try to lift, you actually need to have good communication. You can see both persons are squatting, knees bent, back straight, elbows locked in, and they are lifting together at the same time. You must be able to communicate with your colleague. Okay, are you ready? 1, 2, 3, stand. Not when you're on one, the person is already lifting. No, each person has to lift at the same time so that no one is caught unprepared. Are you ready, Mike? Yes. 1, 2, 3, stand. On stand, we stand up together, not on 3. You can say on 3, we stand, or when I say stand, we get up, so that the person doesn't assume you are saying stand on 3, not on stand. It's very important. It looks like a little hiccup, but it's very important where you can have problems. Then the next one we want to look at is recovery position. Recovery position means it's used for responsive and unresponsive persons who have no breathing or circulation problems or no head or neck injuries being suspected. So they are breathing well, they have their pulse is, they have a pulse, their heart is beating, but they are not awake. You've tried to wake them up, you've tried to get a reaction from them, but you can't get anything. So you actually need to put them in a recovery position. Some persons that faint on the road, it's not to start pouring them water or raising them up, raising their head up or anything. The best thing you can do is to put the person in a recovery position. And the way to do this is to kneel beside the person on their left side or raise their arms straight above their head. Place it, cross the right arm over the chest, placing the right hand next to the person's cheek. As you can see here, this is the right arm, that's the left arm. So raise the left arm above the person's head, raise the right arm, put the person's palm on their cheek. Now you should be doing this depending on which side you're kneeling on. She's kneeling on the left, so the right arm is going to be resting on the victim's left cheek. Then raise the knee until it's completely flexed or bent. Once you do this, you can see the arm is still beside the person's cheek. Again, remember, this person is unconscious, so anything you do is what the body sticks with. Hold the knee, hold the back of the person's arm or the shoulders. Carefully, using the knee and shoulders, carefully pull the person on their side, not away from you, pull the person towards you. Now, what's going to happen is this. The knee is preventing the person's body from going flat on the ground. The arm is helping to protect the head and keep the head away from the ground. The palm is also keeping the head and the mouth accessible for the person to breathe and for any bodily fluid to flow out of the person's mouth if possible. Once you've done that, this is what we call the recovery position. Once you've done that, you can check to confirm whether the person is breathing, check the person's airway, check whether the person still has a pulse. Sorry, excuse me. Now there are various moves that you can use to move a person. We have something we call the log roll. This can be used to roll an ill and injured person from their back to their side to allow for airway drainage, control bleeding from their back, or to place them on a backboard. It can also be used to roll a person from a face down to a face up position. To do this, ideally, you actually need 3 persons to help you with this. 1 person holding the head or stabilizing the head to prevent the neck from rolling to either side. 1 person around the shoulder to the waist, and the 3rd person from the waist to the feet of the patient. That's what we see here. This lady is keeping the head stable so that it doesn't shake when they roll the person to her side. You can see this man here now. He's holding and keeping the shoulders to the waist stable. The 3rd officer is actually holding the waist down to the feet to keep it stable also. If they had a backboard, they could actually slide this under the patient's back in the opening that they've made there, then lay the person back down on the backboard and take the person to the hospital as soon as possible. Another is what we call the extremity lifts. This is where a person must be lifted from the ground to the chair or to some type of stretcher. Now, you should only do this once you know that there is no neck or back injury. And to do this, 1 person kneels behind the person, grabbing their wrists. You kneel behind, put your arms under the person's armpits, grab your wrists. The 2nd person kneels beside the person, grabs in their knees, and again, on 1, 2, 3, lifts. Stand up together. And that's what we have here. So you can see the lady, she knelt behind the victim. She put her arms under the person's armpits. Her fists are actually grasped together in front. The other victim is holding the knee with his hands grasped together, and that's your extremity lift. So you can lift the person from the ground, and they're bringing the person up to the stretcher, which we see at the end of the screen here. We have something that they call stair chair, which is an assistive device that helps to move someone from a high floor down a flight of stairs to the ground floor. So most times these devices are actually not available in all settings. You might not find them everywhere, but it's actually very comfortable. You don't need to start trying to use a stretcher to bring somebody down via a flight of stairs. Once you have this safety chair, put the person on the chair using the extremity move, strap the person into the chair, and just safely bring the person down. The chairs have tires and some little lift devices that it's very easy for them just to roll down the steps without shaking up and down. And the person just comes down and you take the person to the hospital. Some of these chairs can actually switch into stretchers on the go. So it's the same way, place the injured person on the chair. 1 person stands behind the chair, grabs in the back. Another responder kneels in front, grabs in the chair legs. The spotter is the guy that we just saw who is making sure. I'll have to go back to show you again. This is the person we call the spotter. So he's the one that he can see his hand on this guy's back. This guy is not looking backwards. He doesn't know what's happening. So the spotter is telling him 3 more steps, 2 more steps. We've reached the ground floor. Step off, and you're on the ground floor. Come back a bit. That's the spotter's job. Then the one that we commonly know, which is the clothes drag, where you have to drag someone. Yes, for anyone, Jane, sorry, it's actually live right now, so it should be recorded. Clothes drag, you're grabbing the person's clothes, and that's what you're going to use to drag the person away from the scenario that you find them in. You should kneel at the person's head, grab the clothes at the shoulders, raise the person, and drag the person to a safer scenario. To a safer spot, sorry. And that's what we have here. You can see he's not grasping the person's arm or neck, he's grasping the person's clothes. And that's what he's going to use to drag the person from where he is out or backwards. One thing we need to note now is choking. And this is where airway management comes in. We've seen scenarios where people say, did you hear David died? What happened? He was eating. The next thing, he held his neck and collapsed. It looks like they sent it from the village. His village, he has been saying, his village people hate him. What might have happened is this guy choked to death. We're all aware that AFCON is currently on. Yesterday's match was penalties. Most likely somebody's supporting, was it Ivory Coast? Yeah, Ivory Coast and Senegal. Somebody's supporting Senegal, and you might have been chewing your nkwobi or goat meat and drinking, and you're enjoying the match. Maybe when you wanted to swallow the next part of the meat, that was when Senegal lost one of their penalty shots, and you now shouted, "Go!" You now start hearing those sounds. That means the food particle has entered the wrong pathway, and it's now choking the victim. So most persons will see someone choking and be asking, "What is it? What is it?" The person is pointing at their throat. They will say, sorry, what is it? Water, give him water, give him water. That's making matters worse. The person is saying, something is stuck in my throat. When something is stuck in your throat, it means nothing more can go in. You can only try to bring out whatever is there. And that's where you need to use the Heimlich maneuver, which we're going to talk of next. Signs of choking include inability to breathe, inability to cough, and inability to speak. When someone is choking, they cannot tell you, I'm choking, no, I'm choking. You will see them doing, they're pointing at their throats or holding their throats. They're just pointing because they cannot tell you this is a problem. They can't say anything. So it's a true emergency and you must care for it immediately. To do this, you have to stand directly behind the person, place one hand in form of a fist directly above the person's belly button. The fist should be thumb side against the person and held tightly. Reach around with the other hand and grabs the fist, pulling it tightly against the person's abdomen. Then you pull inward and upward sharply. Now, this is just a picture, but I'd like us to watch this video, which should clearly show us how to help someone who is choking. So you can either do this via back blows for children. You can either do this via back blows for children. This is for infants. What we just saw right a few minutes ago was for children and adults. This is what you do when an infant is choking, when they chew pebbles or make the mistake of putting granules into their mouths. This is what you do. Now it's back slaps. It's actually back slaps. You are giving, the video is just showing you slowly what you're supposed to do. So you're not just tapping so slowly. You actually have to forcefully strike the infant between the shoulder blades to try to expel the objects. For the Heimlich maneuver, you're trying to pump out any air that's left in the stomach out through the mouth, it will feel like the person wants to throw up or vomit. But that's your aim. You actually want to pump air or gases out of the person's mouth, and that would temporarily push the object out of the mouth. It actually helps. Yes, you're supposed to hit hard. We didn't say you should just slap the person on the back. You're trying to force the object out of the person's mouth. Remember, it is blocking the person's airway. The person cannot breathe. The person cannot breathe through their nostril. The person cannot breathe through their mouth. So you actually need to forcefully strike the person to try to expel the object. But remember, after you finish doing the back slaps for an infant or back slaps for a child or Heimlich maneuver for an adult, you actually need to take the person to the hospital in case anything might have been bruised. Sometimes you might try to do the Heimlich maneuver. You might try to expel the object by back slaps or back thrust or chest thrust, and the object doesn't come out. Next thing you'll notice that the person will lose consciousness. And once the person has reached the ground, the only thing you want to do is you want to make sure that there's an open airway. So you position the person face up from the ground by rolling them on their back. Then the person is now in a position that allows for proper assessment for their airway and breathing status. It's actually called the head tilt chin lift maneuver. So you just tilt the person's head upwards. Remember when we want to take drugs, we actually tilt our head backwards to drop for those of us who take our medicine without water, you tilt your head backwards and just drop the tablet inside and swallow. That's the same method. You have to tilt the person's head backwards so that the airway is open. Position your hand, or position yourself first, opposite the person's head, position your hands, lift the chin and tilt the head backwards. You have to put equal pressure on both hands to gently do this. Since the tongue is attached to the lower jaw, tilting the head back will lift the tongue off the back of the throat and open the victim's airway. We have what is called the abnormal breathing and normal breathing. The breathing is a normal process that occurs approximately 18,000 times a day. So each of us actually breathes in and out approximately 18,000 times. You take about 12 to 20 breaths per minute. And anyone who is breathing, you will always see chest rise on the chest or abdomen. Now, this is the normal way we breathe, right? But what happens when you're having respiratory difficulty? There's increased respiratory rates. You see the person breathing faster because the person is not getting enough air. Increased work of breathing, the person will tend to have a panicked look. You see obvious movement of the chest and abdomen, and you also see use of the neck muscles. Now, note again, if someone who is having respiratory difficulties is in crisis, it's possible that they'll also go into respiratory arrest. And this is the complete stoppage of breathing. You must care for someone who is having a respiratory emergency. Now, depending on where you are, if it's the United States, you call 111. The UK here, what we call is 911 for the US. The UK is 111. For Nigeria, I think it's 122. I think it's 122 or 112, one of the two. But that's the emergency number. When you call, you actually need to tell them what is happening so that they will advise on your steps to take. You need to remain calm and reassure the victim. Assist with positioning of the person's body for comfort, losing any tight clothing, and assist the person with their medication. This is a situation where the person is asthmatic. All victims can actually be categorized as either ill or injured. It can be the person is having difficulty breathing, the person is having chest pains, the person is having dizziness. Mechanisms of injury describe the general cause of the person's injury. Is it a vehicle collision, which caused, back to nature of illness, mechanism of injury, vehicle collision causing difficulty breathing, fall from height causing chest pain or dizziness, or a twisted ankle that's causing the person to become dizzy. So it all connects to each other. Sometimes it's actually easy to identify people who are seriously injured or ill, but sometimes it may be difficult to tell how ill or injured they are. So when you arrive, you need to confirm if it's an injury that warrants calling an emergency medical services to rush down to where the victim is. So generally, by looking at the ill or injured person and being able to determine their condition, this is called general impression. It's simply how the person appears to you that will determine, okay, I need to call 911, I need to call 112, I need to call 111. That's where general impression comes in. Okay, so if I have to ask now, I can see some messages, I'll still read it. Can you give me a situation, an example of an obviously ill or injured person that may appear less serious than they are? You see a victim. Can you give me an example of such significant mechanisms that might come into play? Anyone? Okay, let me just answer these questions here. Ngozi, differentiate between Heimlich and abdominal thrust is actually the same, depending on, some persons call it abdominal thrust. The correct name is the Heimlich maneuver. I'm sorry, Abisola, I'm not sure how do we position the person. I'm not sure what you mean by that. In what scenario are you looking at? What happens if the patient is taller than the healthcare provider during choking? How do we attempt chest thrust? It's not chest thrust for adults. Abdominal thrusts. You only do chest thrusts if the person is overweight and you cannot bring your arms around the person's tummy, or if the person is pregnant, then you have to do chest thrust. Chest thrust, you have to make sure that your fists are between the person's breasts, directly on the sternum. That's where you're going to use to do your chest thrust. Again, if the person is overweight or if the person is pregnant, that's when you only do chest thrust. For a choking patient, normally it's the abdominal thrust. Do Nigeria really have emergency response? Yes, Nigeria has emergency response contact. One, like I said, I did know about that. That was 112 or 122. I have to confirm that 122 or 112. But yeah, they do have. Yeah, thank you, Hamid. It's actually 112. No, the person is, Abisola, the person is standing and you're behind the person and your arms are around the person's stomach, again, above the belly button, directly above the belly button, not too far. You're thrusting towards yourself. I don't think you can thrust forward. You have to thrust towards yourself. You're trying to forcefully compress the person's stomach to expel the air. Angina attack, yep, thank you. Hamid, thank you. Head trauma, differentiate. I think I just answered that, Ngozi. Heimlich and abdominal thrust. It's actually the same. People call it abdominal thrust. How do I put this down? It's just like saying WAEC and SSC. So WAEC is the exam. SSC, general term that we call it when we want to write that exam. So that's it. Abdominal thrust. To try to trust it, the given name is Heimlich maneuver. Okay, Thank you everyone. Thank you, Tega. Yep. So you have signs and you have symptoms. Signs are something that you can see and measure. This might include bleeding, swelling, vital signs. Symptoms are pain, nausea, dizziness. Signs, you hit somebody and the person's eye starts swelling. That's a sign. Symptom, you hit somebody, you're not seeing anything happening on the person's body, but the person now starts complaining, I'm having pain in my head. My head is paining me. What happened? Okay, somebody just playfully hit me, used something to hit me on my head. That's it. So that's the difference between the two of them. So remember that you actually want to gather as much information from the ill or injured person as possible. And you can do this by performing a hands-on assessment and asking specific questions to the person. And these tasks actually make up assessment. This is what we mean by assessment. You need to assess the person before emergency services actually come. So you can see the scene. The guy is lying on the ground. First thing you have to do is scene size up. It's broken down into different components. You actually need to size up the scene to know exactly what you are looking out for. And what you're looking out for first is safety. You need to be sure that scene is safe. You can see tractors all around the person. Does this scene look safe? The tractors are a bit far away from the person. There don't seem to be any broken glass or anything close to the victim. You can say, okay, the scene is safe. Nature of illness or mechanism of injury, what happened? Did the tractor hit him or did he fall from the tractor? You have to do your best to actually determine if there's an illness of some kind or if it's an injury. Additional resources, you must determine the need for additional resources, whether you're calling the police, whether you're calling ambulance. You need to determine when you approach the patient and assess the patient. Then you have to determine whether there's a possibility of neck or back injury. If so, you must keep the person still, manually stabilize the head and neck as best as you can. The primary assessment is to identify and care for any immediate life threats. These immediate life threats could involve blocked airway, anything that disrupts normal breathing or normal circulation, including severe breathing. Primary assessment consists of mental status, airway, breathing, circulation. And we call this mental status AVPU. AVPU. So if the person is awake, you must determine if they are alert or confused. The person who is aware knows exactly where he is, and as such, it sometimes might be not so urgent. But if someone is disoriented or confused, then you know that there's actually a problem. In these cases, you must activate emergency response. And when we are talking about AVPU, first thing you have to look at is A, which is alert. Which is alert. You need to know if the person is awake to determine his mental status. V, verbal. Hello, sir, are you okay? Or hello, ma, are you okay? Can you hear me? The person says yes. That means the person verbalized to you. P, pain. This is when a person will only respond when a painful stimulus is performed. Maybe if you pinch the person, that's where the person moves, but you try to tap the person on the arm, the person moves. If you leave the person, you're calling out to the person doesn't answer you. You have to confirm that. So U is unresponsive. This means you pinch the person, you tap the person on the shoulders, the person doesn't respond, then the person is totally unresponsive. And you need to pay close attention to these changes. Still on primary assessments, you need to adequately check if the person is breathing in or out, if you can hear anything to be sure if the airway is clear or not. You need to check the person's breathing status. An open airway is only half. An open airway is only half of the equation regarding adequate oxygen for the ill and injured person. The person must actually be getting enough air into their lungs and out of their lung. If you feel the person is not breathing adequately, you must provide rescue breaths. How many of us know how to check our pulse? Some of us always say, okay, you can check your pulse by your neck, cranial artery, that's the easiest way to check it. But some first aiders, you advise not to check a pulse because most times you spend more than necessary time trying to find that pulse and you ignore everything else. So most times you just say go straight into CPR, which we'll talk more on in the CPR when we have this tomorrow. So we've talked about first primary assessment. Let's look at secondary assessments. It should not be started until all life threats identified in the primary assessment have been covered, and it only consists of two components, history and physical exam. In history, one helpful tool can be the mnemonic again, sample. S, signs and symptoms. Where does it hurt? How do you feel? How does this feel? If I'm touching here, are you feeling pain here or here? A, allergies. Are you allergic to any drug? Is there anything we should know about you're allergic to? Can you take aspirin? Yes or no? Medications. Do you take any prescription or non-prescription medication? Have you been taking them as prescribed? Have you been taking them when you're supposed to or not? What's your past medical history? Is there any existing medical history that we should know about? Has this actually happened before? Have you collapsed like this before? Have you had your head turning you before? Have you fainted before? Let's know about it. Last oral intake. When was the last time you ate? When was the last time you had water? Was it an hour ago? 2 hours ago? We actually want to know. Events leading to the call. What were you doing when the incident occurred? Did you do something that actually caused this? Were you bending down too much before you tried to rise up and you collapsed? Were you touching live wire before it electrocuted you and you collapsed? All these questions actually need to be answered, and this is the history part of it. But you should know that this is for adults who can answer you. But when dealing with children, most times they will not be able to provide all the information that you're asking for. In these cases, you will have to rely on family members or bystanders as much as possible. Sir, did you see what happened? Oh, yes, I saw him. He had been bending down, putting his head between his neck. And when he tried to stand up, that was when he collapsed. We've gotten the history. You cannot ask the person, and maybe a child, do you know when this child ate last? We left the house 5 hours ago. That's the only time they've eaten. She hasn't had a drink of water. If he hasn't eaten yet, at least you have those information, and you actually need to get this. Then you have the second part, which is the secondary assessment, which is the physical examination. First one was history. This is the physical examination. Again, it's a must. You can hear me saying this since the start of this course. You must protect yourself before you try to help any victim. You must protect yourself. You have the mnemonic again, BPDOC, BP doc. You can call it BP doc, BP-doc if you want to remember it easily. B, blood. Always inspect the body for any bleeding. P, pain. Ask the person if they have any pain or where it is. Then check the 8 other areas to see if they're as painful as the previous places that you touched. D stands for deformities. You need to look for any kinds of swelling, any bumps, any bent limbs or broken limbs. O is for open wounds. You need to look for any open wounds by causing bleeding. C is for what we call crepitus. This is a crackling or grating feeling or sound under the skin or in joints. So it's very important when you're examining an unresponsive person, and they can't tell you exactly where it's hot. So you need to do this by yourself. If you're hearing those crackling, grating feelings, then that's your C for you. It to tell you that the person has problems with their bones or joints. Now, during physical exam, you have to check the entire body. And again, you must be using your gloves. This is what they are doing here. You physically examine each aspect of the body. You check the head and neck. If you suspect any injury to that point, then you have someone hold the person's neck in place. If you're alone and the person is conscious, ask the person to keep their hands and neck as still as possible while you check their extremities for any broken bones, open wounds, and such, as we just mentioned in the BP talks. You check the chest first. Now, chest injuries can cause internal bleeding and can cause difficulties in breathing. So you actually need to carefully monitor the breathing status of those with chest injuries. Let me see, I think there's some questions here, sorry. It's after 9. Sorry, we're almost done. Doctors. Somebody said, Airway comes first if you are using the A, B, C, D, E. Remember that 2001 of the changes, which we'll talk about in the CPR, one of the changes is in 2010, it was switched from the ABC sequence to the CAB sequence, which is chest compressions, airway, and breathing. Pelvis, hip, you check these areas if there's any serious internal bleeding. Legs and feet. It may be necessary to remove clothing to expose the legs and feet so that the injuries can be seen. Ask the person if they can move their feet and feel the feet as you touch them. So it's 9 p.m. Oh, sorry, mine is 8 p.m. here, and that's why I actually forgot this. I'm very sorry about this. So it's 9:08, sorry. Let's keep to time. We're going to stop at this point, and we'll continue from tomorrow with still the same thing, checking for injuries. We'll continue with vital signs from tomorrow, then finish up with the CPR. I know it's a bit long. Thank you everyone for joining. And let me see if I have any questions. And yeah. So I'll see you guys tomorrow and we continue. Okay, so thank you everyone. And if you have any questions, you can join in the WhatsApp group and put them out and I'll handle that. Have a good night rest, everyone. Okay, thank you. Thank you, Dr. Lucci. We'll see you guys tomorrow, okay? So apologies for taking your time. It's actually long. Thank you. Have a good night rest, everyone. Oh, sorry. I forgot I actually muted everybody. Where's this? Can't find it again. Oops. Participants, okay. Sorry, I forgot I muted everyone. If you listen.
Sarange.
Yeah.
Okay, thank you everyone. Good night.
Oh, thank you, doctor. See you tomorrow.
See you tomorrow. Thanks.
Yes, sir.
God bless us. See you tomorrow.
Thank you.
Okay. Bye.
Okay, bye.
Okay, good night. Good night, everybody.
Good night.
So, good night, everyone.
Good night.